principle which Ayurveda works is nourishment.
Hi there, and welcome to another episode of Shift with Shubhra. I'm your host, Shubhra Vanetti. I'm a certified sleep consultant for babies and adults. I'm also a baby science program instructor and an Akashic light healing practitioner. So, welcome to another episode. And today we will be interviewing Dr. Satyam Tripathi. Dr. Satyam specializes in Ayurveda, and I'm really excited about today's episode because Ayurveda has always been a very interesting idea for me because I am from India originally, and it is one of the oldest holistic healing systems that is available still in the world today, along with traditional Chinese medicine. So Ayurvedic medicine, or Ayurveda as it's commonly known as, is the belief that health and wellness depends on the fine balance between the mind, body, and spirit. I wanted to invite Dr. Satyam today to basically enlighten us what is the history of Ayurvedic medicine, what is it all about, how do they ascertain what is the fine balance between the mind, body, and spirit, what does that mean in the Ayurvedic context, and the kind of therapies and the diagnoses that they probably use in this particular practice. So I hope you enjoy today's content, and if you know anyone who would benefit from this interview's content and information, don't forget to like, comment, or subscribe, and please definitely share this episode with someone who you think would benefit from the content. Thank you so much and enjoy the episode. So I just wanted to ask, can you tell us a little bit about how you became an Ayurvedic doctor? What led you to this journey?
I was grown in a family where my grandfather was a cooperative inspector. It was the time of India's independence where he started his job, and it was like after colonization, he was into that. And then following to my father, who also was working as a professional in government forest department. So my childhood was like near to the forest, in the forest, you can say, because when you are a forest officer, a lot of things they have to be there in the forest.
Wow.
So it was somehow like inbuilt, because that's how what happens. No, if you are grown in a cosmopolitan city, you will think like a cosmopolitan person when you are born there. So your thought process like that. So you get attracted. It becomes easier also. And then it was something which is like when you always keep listening about, hearing about, this helps in this helps in that. So you get more curiosity. So that curiosity was there, that I want to find out how it can really help people in a much better way. And when it came to my choice as a professional, as a doctor, so then I felt that I can choose this, which will be more easier, better, and something which will be satisfying my passion as well. So I went for that, and I completed my doctor degree. Following with that, I went for the specialization, which includes yoga as well. So yoga and then rehabilitation, where we then it became a journey. Like when you started doing your specialization, then you think of specific diseases. Where I went for diabetes, hypertension, HIV and cancer conditions, and then went on and on and on, and finally, where am I?
And when did you come to Singapore to establish your Ayurvedic practice?
As a full-fledged doctor, I came to Singapore in 2012. End of 2012, I came, and then, of course, before that also, I used to come here, but that was not something like to build up a career. It was something like an invited guest for speaking, for some workshops and all, where I felt that Singapore is a good place where you can really express your potential, and at the same time, there is one place where you have good crowd and good number of people who can give you the knowledge, which is India. Like there are 100 people, but there are 100 doctors also to give enough knowledge. But there is another part of the world, there are 100 people, but there are only 1 or 2 people to serve. So then thought that maybe this part of the world needs service, which compared to the other crowd, and that's how I moved to Singapore.
I see. Okay, wonderful. So then could you just elaborate a little bit about what really is Ayurveda? Like what is the main principles, or as we say back home, the funda, the foundation and the ideas behind Ayurveda?
See, Ayurveda can be explained in many different ways, but what I will like to explain clinically, it is in this way. Ayurveda comes into three packets. One packet is all about your diet and lifestyle, where it teaches you how and what are the things which you have to eat, what are the spices which you have to put. If not spices, those spices are now replaced by some supplements as well. Like turmeric is also a supplement nowadays. The tulsi, which is also called as holy basil, is also a supplement nowadays, but it is also a kind of food which we put it into our vegetables or in our normal staple food.
Mm,
So that's what's the first segment.
right.
Second segment of Ayurveda is about detox.
Okay.
The channels has to be clean, because no matter whatever food, nutrition, supplements, or whatever you are talking about, if that is not reaching to the target area where it is supposed to reach, then no point in taking that, no? Because it is getting continuously getting blocked. It is continuously getting stopped somewhere. So that's how the patient come to me, and then when I will be asking them to take some food or something, they'll say like, doctor, it doesn't work and this, and then I have to tell them the exact thing that why it doesn't work. So it happens to many common people, like whom you will be also meeting, maybe to you also, that if you eat this, it doesn't work. But because we have channels all over the body: digestive channel, respiratory channel, excretory channel. So these are all channels over channels in your body. Even blood vessels, the arteries and veins are also channels. So these are channels, and channels have blockage. So this has to be clean. So that's a important thing which Ayurveda talks. So one principle is about food and diet, and second principle is about detoxification, and the third principle which Ayurveda works is nourishment.
Mm,
One nourishment which we talk is diet and nutrition in a normal way. One nourishment is what you do, or which you give it to the body, is transmembranous and transdermal. Transmembranous and transdermal means something which you apply on the body or something which you put on the body. So this is dermis, this is skin, not dermis and epidermis. So you are trying to move something transdermal,
mm,
and inside the body there are membranes. So when the herbs reach inside the body, they are moving one membrane over another membrane through the process of osmosis. Okay, of course in Ayurveda they don't to say the word osmosis, but it is important to mention this word, because if there are people who are trained in modern medicine, or they understand the modern medical science, they need to understand that how exactly things are moving in. Otherwise it will look like a mysterious science I'm talking about. So transdermal and transmembranal things has to be done. That includes therapy in yoga. People go for different kind of therapy in yoga, which can be done on the head, which can be done on the eyes, which can be done on the nose, which can be done on the heart, which can be done on the spine, which can be done on the knee. So what is that Ayurveda is doing is transdermal and transmembranal. So Ayurveda is a combination of daily diet and lifestyle. Second thing is as a therapy, and the third thing is as a detox. And all these things are encompassed by the three parameters which ultimately work, which we call it as Vata, Pitta, and Kapha.
okay.
So Vata, Pitta, and Kapha is it's like a wrapper, you
Mm,
know, outside. Everything has to go through. Like if you want to go in, you have to break the wrapper, you have to open the wrapper, right? So you have to understand Vata, Pitta, and Kapha, so that you can go inside,
okay.
right? And along with that, when you open the wrapper, you also have a hard case, inside the gift is packed. So the hard case is 7 tissues in our bodies,
Mm,
which are rasa, rakta, mamsa, meda, asti, majja, shukra, which means plasma, blood, muscle fat, bone marrow, adipose tissues, and finally, which is the sperm and ovum, reproductive cells. So all these things together make a health according to Ayurveda, which includes the toxins also of our body, the waste products of also
right.
our body, like urine, feces, sweat. Not only just three, which is commonly known now, wax, the wax inside the ears, under the hair follicles, mucus, or phlegm inside the body. Hair and nails are also the byproducts and the waste products of the body. So all these things together make one as Ayurveda.
Right. And you were mentioning about Vata, Pitta, and Kapha. Can you just elaborate what is Vata, Pitta, and Kapha?
Okay,